Hi, everyone. Welcome to today's Lunch and Learn. We have Dr. Sarah Okey presenting on Motivated to Learn. Can we use incentives to drive bud tender training to sell cannabis safety? And just a couple of announcements. As you can see, this call is being recorded. And next month for our Lunch and Learn, we will have Dr. Sarah Cover, who will be presenting on executive function and communication in early adulthood in the context of FASD, family perspectives. So if you are interested in that, please feel free to reach out to me and I will get you all of the information you need. In the meantime, we have our own Bia Carlini who will be introducing Dr. Sarah Okey. So, welcome both of you.
Thanks, Sarah. It's with so much delight I'm introducing Sarah Okey today, in part because it was also delight about 2 years ago or so. Sarah can correct me on that a Washington State Liquor and Cannabis Board created a research division to work in Washington State with data from Washington State. And Dr. Sarah Okey, is currently the research program manager of this very daring initiative led by Jim Volendroff to create this in Washington State. Dr. Okey holds a PhD in clinical psychology from Washington State University and is specialized in implementation science, where she leads statewide and national efforts to standardize data and evidence-based policy. Part of her recent work includes a series of studies involving the role of retail cannabis staff in consumer decision making, as well as in the development of a bud tender education survey currently being adopted by other states, for instance, Oklahoma, to create a national standard for bud tender education and retail environment monitoring. Thanks so much for taking the time to talk to us today, and welcome, Dr. Okey.
Thank you so much. It's wonderful to be here on this Lunch and Learn. I'm curious if anyone is actually eating their lunch during this Lunch and Learn. And if so, what are you eating? Um, so uh, thank you so much for having me. You all my screen is already up. Please correct me if I'm wrong. Um, thank you for the kind introduction, Dr. Carlini. Yes, I lead research within our at the Washington State Liquor and Cannabis Board, um, and and it's been since 2023 since research really came on board. And I was just telling someone recently that it feels like it's been no time at all and also a lifetime that that I started here. And every single day it truly feels like I'm learning something new still. So this presentation is going to discuss results from last year's Bud Tender Education Survey, where we examined whether and to what extent cannabis retail force are motivated to learn. And before I dive in, I really want to acknowledge my research staff, Nick, who is here, Dr. Glodowski, and also Dr. Tyler Watson, who's also been really invaluable to the research program development at the Liquor and Cannabis Board, and also to this specific project. So I want to start with this framing because I think it really captures the gap that motivated this study and also this series of work. Most cannabis retail staff, the people that we commonly call bud tenders, are fielding customer questions every single day. Questions like what might help me sleep better at night, what's good for someone who is new to cannabis. And most of these workers don't have any formal training to answer those questions. So the two questions that we set out to answer were, what does this workforce need from us, and what will they show up for? Because you can really design the most beautiful training program in the world, but if nobody takes it, or if no one pays attention when the training is actually occurring, and we've all been there, it doesn't really have that impact. So here's what I'll be covering today. I'll start with about 5 minutes of background to set the stage, why this workforce matters, and then I'll do a brief overview of the methods. I'll jump into findings, and then we'll end with implications. So this is a workforce that really didn't exist a few decades ago. Before legalization, there was no such thing as a licensed legal cannabis retail employee. But now this role has really become a primary point of contact for millions of adults who use cannabis legally in the US. Okay, and so in the right-hand corner of some of these transition slides, I have some quick facts just to play around with this idea of education in the cannabis environment just for fun. Really, when I was designing these slides at the last minute, I was trying to find some fun pictures, and I saw these cool trichomes, which are tiny crystal-like structures on the cannabis plant that are responsible for producing cannabinoids and terpenes. And I thought, wow, this is so cool. How can I get this in here? So there's 3 of these quick facts in here. But back to this project. As I mentioned, this role has become a primary point of contact for millions of adults using cannabis legally. And when I say primary point of contact, I want to put some numbers behind that. So in our previous work here in Washington State, we found that 90% of customers report asking bud tenders questions about cannabis prior to making a purchase. So that's the norm. For anybody who's going into a retail store, they're asking bud tenders questions. And I think that's a behavior of how the store is really set up right now. Nationally, studies have found that with one study, Merlin and colleagues, 82% of US retail staff base their product recommendations on personal experience, not on training, not on evidence-based guidelines, but what they have personally tried. And then a study in Canada has found that 88% of retail staff have received questions about medical cannabis. So what we're seeing in the workforce that is functioning is that bud tenders are really acting as information intermediaries. They're sitting between the consumer and the product, and they're being asked these questions that in really any other context, it would be really directed to the provider that has more of these technical training information. So how are states addressing this? As with a lot of these other cannabis landscape, very inconsistent across states. I created this map based off of a study from published in the Journal of Public Health and Management and Practice in 2024. They found that 7 out of 20 adult use states, so adult use, not medical, require any kind of structured, only 7 out of 20 adult use only states require any kind of structured training for retail cannabis staff. Among those 7, the requirements varied widely. So some states required state certified training. Other states required employees to provide some form of training with very little guidance. The majority of adult use states, and that's the one that's like in this dark, I don't know what you would call that, dark teal, have no state mandated training for people who are selling cannabis to adults, so not medical use. and Washington is one of those. Several studies have documented specific knowledge gaps too, with potential health and safety implications as well. So for example, qualitative research in Washington State with our very own team here, with Dr. Carlini and colleagues, have found that bud tenders did not believe their job involved discussing cannabis use during pregnancy or driving, cannabis use while driving, prioritizing customer autonomy over education on these topics. So now to understand the Washington context specifically, we need to understand that we really have a dual regulatory structure in Washington State. On the one side, you have where I sit at the Liquor and Cannabis Board. So we license retail stores. We enforce the cannabis laws and regulations, and there's no mandatory bud tender training requirements on our side. On the other hand, we have the Department of Health. They set the medical product standards, they manage medical patient registry, they credential medical cannabis consultants. So every store that holds a medical endorsement is required to have at least one credentialed medical cannabis consultant on staff. I pulled this information from from the Department of Health's data and stat. You can see this URL faintly. Just yesterday, it's from April 2026, about 2/3 of our stores hold a medical endorsement. As of this month, there are 668 active certified consultants statewide. So in Washington State, we don't actually keep track of how many employees each of our retail stores have. But in this survey that I'll be talking about later, we did ask ask license holders how many stores they have, which is up to 5, and how many employees they have. And based on this survey, we estimate roughly on average, and there is a large spread there, so this is kind of a back of a napkin average, about 10 full-time equivalents and 3 part-time equivalents on average. But so that means that if that was spread evenly across all stores, that's about 1 per 6 employees that have a medical cannabis consultant. So there's really this gap where there's this, credentialing pathway through Department of Health for medical consultants. It is voluntary. There are people that choose to sign up to gain that training, but there's not a required general training requirement for the broader retail workforce. And there's a lot of individuals that, if there is 1 in 6, there's a lot of people that are going and receiving questions that are not having training at all. And so that's the gap that this study was designed to help us understand. So why did we do this study? So this work builds on prior collaborations between the Liquor and Cannabis Board and the Department of Health. And so on the left, you can see our earlier paper, what influences cannabis purchasing decisions, perspectives from cannabis retail employees and customers in Washington State. This was published in Cannabis and Cannabinoid Research, and that study gave us the cannabis adult cannabis consumer and employee perspective on what drives purchasing behaviors. And our colleagues, we at the Liquor and Cannabis Board, and our colleagues who really helped us with this cannabis consumer survey at Department of Health, presented to the board at the Liquor and Cannabis Board on some really key findings from this study last year. And when we were talking about this study, we really came across the fact that there's this really core intervention that happens between the frontline retail staff, this bud tender, and the consumer or the person that is purchasing the cannabis. And our board member, Ollie Garrett, opened this question of what bud tender training in Washington should look like. And I'm just going to read her quotes here because I think they really capture this challenge. So she said, bud tender training came up in the past. It was our goal at the time, but then it wasn't cut and dry. Industry said, here is government again telling us and making it mandatory. And what we didn't take to the next level was what training should and could look like, not just automatically copy what was in place for alcohol. And so board member Garrett was essentially saying we need to revisit this, but we need data to do it right. We can't just transplant the alcohol model. We need to understand what this specific workforce needs, particularly because there are so many differences between cannabis and alcohol, and what the alcohol mandatory server training has compared to cannabis. And so that's exactly what this particular study set out to do, was to really answer this question. So this was the first state-led survey to comprehensively assess our bud tender education needs from both the employee and licensee perspective. And we really did want to intentionally survey both the frontline staff and the owners to see if there were differences between the role. And so then here's quick fact number 2. Solventless concentrates are made by pressing flour between heated plates so that can bypass chemicals like butane. And this, if there's an adult who's choosing concentrates, this can be potentially a safer way relative to more solvent concentrate product. All right, so back to the study. We had 4 study aims. So first, we wanted to characterize the current educational landscape. So how are bud tenders learning now? Second, we wanted to compare responses between those with and without a medical cannabis certification, and between licensees and staff. And then third, we wanted to predict independent predictors of training motivation, what drives someone to want more training. And fourth, and this really just kind of is wraparound, everything we do here in the research program is really to inform policy with empirical data. So in terms of methods, this was a cross-sectional online survey, completely anonymous. We had absolutely no incentives here. It was conducted between January and June of 2025. We recruited through LCB email listservs to all of our licensees. We physically mailed the flyers to our licensees. And we also had our compliance officers who, from our enforcement and education division, help flyer as well towards the end of the recruitment period. We did go through our Washington State Institutional Review Board to get an exempt determination. The survey measured a really broad set of measures: demographics, tenure and role, medication cannabis certification, customer interactions, role relevance ratings, what training topics interest them, their training history, their preferred formats in training, their perceived barriers and motivators to training. And then for analysis, we used really just Pearson chi-square Wilcoxon ranks them for ordinal items and then multivariable logistic regressions. Okay, so let's get into the findings, and no quick fact here because we're going to get into the fun quick facts. So we had 332 respondents in total, 277 frontline staff, and 55 licensees or store owners. So the staff had about a mean age of 35 years old, about 6 years in the industry mean, and about 40% were medical cannabis consultants. Licensees were older on average, about 51 years old, about 9 years in the industry, and 61% said that they were medical certified as medical consultants. So we really had quite a heavy skew towards medical cannabis consultants, which really did allow us to see if there were differences between medical cannabis consultants or not. There is a really interesting education split here too. Among staff, 56% had a high school diploma as their highest degree, and about 20% had a bachelor's or highest. And that's relative to licensees, about 19% for licensees had their highest degree were high school, relative to about 50% of licensees were bachelor's or higher. So looking at the two, they were relatively different populations, and also categorically, when you think about who might be a license holder versus a frontline staff, is consistent as well. Particularly when you think about the competitiveness it might take for those who are getting into our very strict and licensee market back when it first opened. Okay, so nearly 78, almost 80% of staff reported answering medical questions several times a week or more. And about 74% of licensees said the same. So both groups were telling us that health questions were very, very regular. And this is the part that I find really interesting. When we broke this down by medical cannabis consultants and non-certified personnel, frequency of health questions did not differ between these two groups. So we can see the distribution here. Both groups peak at several times per week. But the pattern across is really similar. So this really tells us that customers are not selectively directing their health questions to the certified person on staff. They're really asking whoever is behind the counter. So this really means that the entire workforce is fielding these questions regardless of the credentialing status. So if there's no formal training requirement for adults, adult use, how are these workers actually learning to do their jobs? So we asked whether they had training experience, and then if they said yes, what their training experience was. The open-ended questions really fell into these four main categories. So the first one was on-the-job peer shadowing. So a quote was, "I shadowed with other bud tenders with more experience." The second type was store-created materials. So dispensaries have a work group with info on products and procedures. There were also some that said that some of these materials included our LCB generated content as well. We have some LCB videos online on YouTube. Self-directed study was one of them, so learned by using cannabis and buying from dispensaries before becoming a bud tender. And then a lot of them actually also said they came from the cultivation and processing experience. So I worked for a cannabis farm before this, and it was mostly all hands-on. So there was a lot of informal job training, but really we didn't really see a lot of standardized evidence-based training on health topics or dosing, harm reduction, drug interactions. We also asked respondents to rate how relevant different roles are to the bud tender role on a scale of 0 to 4. So we had over 25 different roles that we asked. These are the top 5 that they rated. So again, 0 to 4. Checking IDs and preventing underage purchases were the top one. Helping customers have enjoyable experiences, stocking and organizing products, answering questions about product prices, and then recommending products for a specific reason. All were the top 5. So the workforce sees really the checking IDs and preventing underage purchases, which really is consistent with the article Bia that you published with that qualitative found that they were steadfast in that checking IDs, but and also with the autonomy as well. So somewhat similar in that, and I'd be curious to hear your reactions to this role relevance. Maybe at the end we can go back, and I'd be really interested to actually hear your thoughts about this. When we looked at the least central to the bud tender's role, here were the ones that were least central. Information about quitting and reducing use was least central. Information about medication interactions, providing product test results, upselling products to increase sales, and providing resources for adverse reactions. So I do find it interesting, and one thing I was thinking about is, like, I wonder if there's a way that we can potentially, if there's a way, thinking about ways to motivate or incentivize, is there a way to design training that either reframes some of these activities as part of being a great bud tender, as part of being a core competency, because these are all perceptions, right? So I think part of what we were asking is, what do they perceive as being a role relevant role? But also one of the next steps is also trying to figure out, from what are those core competencies are from a state perspective as well. Now, when we compared staff and licensee responses, there were 7 activities when the 2 groups significantly disagreed on how relevant they are to the bud tender role. In every single case, staff rated the activity higher than the licensees did. So staff saw answering product questions, stocking and organizing shelves, instructing how to read packaging and labeling, ensuring required signage is displayed, answering questions about how to use products, answering questions about taste or smell, and information about how to quit or reduce cannabis as higher relative to licensees that rated that role as being less relevant to a bud tender. Interestingly, role relevance ratings were pretty identical between those with and without a medical cannabis certification. There's just one exception: ensuring required signage is displayed. So the medical cannabis consulting credential really did not really change how people see the role itself. So when we ask what topics people actually want training on, cannabinoid education was really the clear leader. People really wanted information on THC and CBD. Almost 84% said that they were interested. State cannabis laws came in second, and then you can see um, uh, these other topics that all were about 60% or higher of people indicating that they really wanted these training topics. So the way we asked this question was, if you were provided training, what type of topics would you be interested in? So different production methods, cannabis-related health education, differences in cannabis types, like flower, concentrates, different types of concentrates, reducing stigma, qualifying medical questions, how to check for IDs, lab testing, and then hemp-derived products. Again, there were no differences in medical cannabis consultants as well. We also asked about the preferred training format, and the answer was super clear. Self-paced, individual online training was the most widely preferred format by a really wide margin. And this is an important policy design because this really means, this is the most scalable and most cost-effective format, and this seems to be the one that the workplace actually prefers. And I think this goes back to the original question too, of if this is the one that the workplace actually prefers, then it should be also one that really encourages them or incentivizes them to also pay attention, because it might also be the one that is easiest to skip through as well. Okay, so let's talk about barriers. What would stop people from participating in training? The number one barrier for both groups was cost, with 76% of licensees and 80% of staff saying that cost was a barrier to training. Number two was lack of staff to keep store running. About 60% of licensees and 56% of staff. Interesting, licensees said that lack of time and day was a big barrier, but staff did not see that, which is interesting. So what this tells us is that owners and managers really perceive time barrier, that frontline staff really, staff are saying we really have the time, we want the training, and owners are really worried about logistics. We also asked about motivators for training. So what would motivate you to complete a training? Again, on the incentive side. And 78% of staff said that it would be motivating for them to receive a training certificate. And 66% of licensees said that it would be motivating for them to have a training certificate for the store. And also a training certificate for the employee, 69%. A lot of the third highest endorsed was training endorsed by LCB. And in fact, that was the second highest for staff. So I think that's a really notable finding for regulatory agencies, that staff really want the Liquor and Cannabis Board as a stamp of approval on training, as it might lend credibility. Other motivators that we added included medical continuing education requirements, store signage promoting trained staff, reduced fines and penalties as well. And none of these differences between licensees staff reached statistical significance. So really both groups really aligned aligned well on what would get them to participate. So here is what I think is the most encouraging finding in the entire study, with a little caveat that I'm going to remain positive here. Nearly 92%, and this is how I found the 92% here, of respondents expressed some interest in additional training opportunities. And that's with this 59% expressed very interested, 17% expressed interested, and 15% expressed somewhat interested. Only 5% said that they were not interested. Now, I do want to flag, and I'll come back to this in the limitations section, that our sample was recruited through LCB. We did have LCB on our flyer. We had no incentives. So it's pretty likely that respondents were more likely, who responded to the survey, were more already likely engaged with regulators. And the people that, engaged with the survey, I think they're, we have to pay attention to the likely selection bias of the survey. Even with that caveat, I think 92% for people who are at least somewhat interested or higher is a really remarkable number. So, I think saying that this entire workforce is resistant to education really is likely not true, right? They're at least some of them are ready to learn. And I didn't attach quotes for people. We also asked that. We also said, okay, you said you were, somewhat interested or interested in train. Why did you say that? I didn't attach quotes to this. I can pull them up. I have them in another presentation I gave, if anybody's interested. And a lot of them say, it's because we need standardized training. It's because we're talking a lot with customers, and it's powerful. So I think this is a positive finding. And the next natural question that we wanted to ask is really, what predicts who is motivated? So this is our last finding, and then we'll go to the implications. We ran a multivariable logistic regression with very interested as the outcome. And because this was really skewed, that's why this is logistics. So this was 1, this was 0. We controlled for role licensee versus Realtel staff, ability to answer questions. So this was general, like how often are you able to answer questions when people answer it? So their perceived ability to answer questions, whether their store sold medically compliant products, whether they are medically cannabis certified, their number of years that they've worked as a bud tender, their age, yes, whether they had a bachelor's degree or higher, yes, no, and whether they're white or not. And the only significant finding was their frequency of customer health related questions. So this implication is pretty powerful. It's the day-to-day experience of being asked health questions that predicts how that, like, very interested in further training, that drives that training motivation. And that's controlling for that medical cannabis certification. All right. So what does this mean for state agencies and the responsible workforce training? And quick fact number 3 is that really medically compliant products are are the only cannabis products in Washington state that have enhanced testing for heavy metals and have that mandatory testing for heavy metals. So first, this really indicates that there needs to be really a shared core curriculum rather than multiple or just one training track for medical only. And this may be helpful and more motivating, and really it's cost effective too. Our results show that certified and non-certified medical cannabis personnel really face the same frequency of health questions, really rate the relevant role activities identically, and are interested in the same training topics. There's really very little differences between those who have the certification and not. So building out a solid workforce-wide core curriculum across all of our retail bud tender workforce really makes sense. So states and in Washington state, but I also am broadening this out a little bit, we have different levers. So we can endorse and coordinate. So our data shows that agency endorsed training is really highly motivating for staff. So looking back, 67% said LCB endorsement would really highly motivate them. So when a state agency puts its name on a training program, it really signals credibility. And this endorsed training, if we're endorsing it, if we've paid attention to what this training is, this would also allow us to have a deeper understanding of what that curriculum is. We can have an easier time tracking progress of how our retail staff are doing across time. If we know what that curriculum is, we can sync with public health professionals to sync with training content to make a broader ripple across our state. And we have standardized, credible content across the field. The second lever is to deliver training in really cost-effective ways through online self-paced formats. It's lower cost, can more easily scale. They also happen, it's also consistent content every time. And I think that consistency really matters when you're trying to ensure evidence-based information. And then the third lever is certifying individuals. And I think this gives a credential and a recognition. And this is important, particularly as this industry grows. If we're looking at this rescheduling, particularly with medical cannabis, this recognition, professional recognition, career mobility, consumer trust, accountability, and quality is going to become more and more important. Okay, so before I wrap up, I just want to note some limitations. As I mentioned before, sample recruitment through LCB channels is really likely overrepresents the respondents that are engaged with regulators. This was cross-sectional, and I mean, I'm sure I'm preaching to the choir when I say this. We know that cannabis market changes very rapidly. Look at the news over the past 2 weeks with what's happening with rescheduling. Self-report data, all of this is self-report. This was very incentivized, and so we had a lot of attrition rates over even the survey, and it's completely voluntary. And then the fourth is generalizability. Washington is very different from any other state. What's exciting is that we're actually in partnership with Oklahoma, and we're working with with them to produce this survey in Oklahoma for their bud tender training, which is mandatory. So that's exciting as we work to start looking at this nationwide. So conclusions. Workforce seems to be engaged and broadly interested in professional development. Licensees and staff seem to diverge on which customer-facing activities they consider central to the role. So we should be really paying attention to a range of perspectives when we're thinking about bud tender roles. And I'm not just talking about in the retail, I'm also talking about state public health when we're coming up with training. Training motivation is really shaped by real-world customer health questions, and the most acute barriers that we found include cost, time, and staffing. Okay, so thank you so much. If you haven't checked out our research program, we have a ton of materials on there. We keep adding every single day. We have, oh good, I did time myself correctly. So I feel that was a success on my end for us to have about 10 minutes for conversations. And yeah, I am actually super curious about how these results compare to your qualitative study that you did as well.
Yeah, thanks. I mean, our work was done in 2017. That's when the data was collected, which seems like a century apart in terms of cannabis legalization timing. But some of the main things, like they don't. In one hand, you see that what drives the interest is health-related questions. On the other hand, if you look at what they feel is the most important role, is not health-related questions. You know, they are in the bottom. What is the most important is ID and help the customer have a good experience with cannabis. Like they want to introduce a plant that they are proud that they use, and they want to enjoy the experience, which can be also safe, of course. So there is a health, a health aspect to it, but it's the enjoyable part. So it's very consistent. But man, it's probably such a different workforce. People that are 7 years in the job, which is, we did that 7 years ago. So yeah, it's probably very different. Yeah, but congrats, and don't, the limitations are natural to this work. I mean, LCB is the only one that could recruit people like this. We try to work again. We can't just not even get in the store. Nobody's wanting to talk to us in terms of university because of the whole, suspicion about research. And, we are in the addiction research center. So it's amazing that LCB can actually get 250 people to talk to you. So congrats on that. Of course, it's biased, of course, it's the ones that want to respond. We just published about healthcare providers, if you saw in the news, and they are whoever wants to respond to us.
Yes, yes.
So I have one question about that, because I was wondering if anybody can have you LCB would be the one that has. Do you have any director or sense of the size of the population of bartender? Like you send email to the stores, or you send emails to, like, for recruiting people? Do you know the base? You know your base population? Because we don't.
Yes. So that's a good question. So we, as I mentioned, we do not track a number of employees per store. So and let me see get this out. So we wanted to, and we've been so many people have asked us how many retail employees are in our store. And survey, we actually have a first estimate. Now, to what extent that estimate accurately is
Mhm.
is accurate? Um, so we found that, let me find my, where. So we found that based on the survey data, roughly, on average, people were saying that they had 10 full-time equivalents and 3 part-time equivalents on average. And I can give you more specific numbers later.
Mhm.
And there are currently, let's see here, medical cannabis, there are currently 464 stores.
Okay.
So if you do the math,
Yes, doing right now. I'm gonna do 12 people to average 5,568. I read somewhere, I have to dig into my things, that it was around 7,000. So roughly it's close. Yeah, and it was an industry document of some kind that I have to look, but I have in some notes. And so it's, yeah, it's pretty reasonable. I mean, it's around 5 to 7,000. Yeah, interesting. It depends what people consider staff and stuff.
so, and this was also a question that that we were also, so a couple years ago, we were looking at like an economic forecast for the number of um, uh, like retailers and producers and processors that could be viable and that we should be authorizing for our social equity and cannabis program. And this was another thing that came up of, well, how many employees are out there? And how many does each store typically have? And so this is something that has come up time and again. In Oklahoma, they do actually keep track of how many they have. So it'll be interesting to see. Um, uh, and just curious to compare and contrast as well.
Yeah, and maybe the 7,000 I have somewhere from some industry source included the other people that are not in the store might be is the cannabis workforce industry in general. So that's why it was 7,000. Yeah. People, you are more than welcome to make questions by just, we can unmute you if you raise your hand, or you can write on the chat. We still have 5 minutes.
Oh, there are.
That's the one I wrote, that one. I wonder if you have any data on the size and demographic of the attendant population. The other one, talk about the free training for bartenders that not required. This is a DOH initiative, right? So you probably don't have much information on how many people are taking or things like that.
No,
Sarah,
but I know, Cher, you're on this call. You might know more about that.
I
let's see.
do. I do know
There.
more. Let's see if I can get. So I can tell you. So the DOH training where I did put the link in, we did work with various groups to develop the materials, including having LCB review. And we did make a decision not to include the detail on serving and the age requirements. There's a little bit in there, but we wanted to make sure that it was more on the really the safety and making sure that businesses were able to provide service to their customers with safety in mind. But there's been actually, we're getting close to 300 attempts at taking the quiz at the end of the training. So we were lucky enough to learn some of what the findings were going to be preliminary in developing this. So we did online. It's takes less than an hour to do. There's 4 different modules. There's close to 300 attempts at the quiz at the end. There's probably only about maybe we're around 175 unique individuals. So you can take the quiz more, you can attempt to take the quiz more than once. We do have a certificate, and we've created just a little swag that I'll be sending out to people who have passed. We have their email asking for their address so they could have a little pin for their lanyards, because that is something that we heard. But yeah, this is really very useful, Sarah, and I can't wait for you to replicate this survey now that the training has been created. Hopefully there'll be some knowledge that their training is available. It's not a huge portion of, all of the retail workers out there, but I'm actually pleased at the number that we've had that have taken the training. And I think it would be wonderful to have LCB endorsement. That would probably be something that would be helpful. And if there is some way then that you could actually officially track who has taken the training. Via your question about the who has taken the training or what that looks like, we did make the decision to not ask about demographic information purposefully, because we would need to have some justification to do that. And we also didn't want to create harm by finding out that it was, only the 60-year-old white people that were taking the training. And we didn't want to create any type of harm on that. But the questions are ready to go if I ever get to that point. But yeah, I'm happy to answer any questions on that. And it's really been great working with LCB and Sarah on when we developed this. So
Okay, we have time for one more question now, coming from Sarah Ross-Biles, already ready to listen. So can I read, or you want to make the question again, Sarah?
I can share it. I was struck by the proportion of folks, and I forget what it was exactly, Sarah, who said they were interested in health education, which seems in contrast, be it to your previous work, interviewing bud tenders about what they saw as their role at all. And I was wondering, maybe both of your takes on what is the time difference here? 6, 7, 8 years between these 2 points.
17
That
to
maybe
25.
perception, just like the industry has changed and the products are more dangerous. I wonder if there's some ripple of that we're seeing in the profession. Pure speculation. Like I say in my comment, comparing these two things is very difficult to do, but yeah, I guess in lacing that with what do we think health education, or Sarah, if you have from looking at these results a lot, a perception of what health education may mean to this group. Yeah, I guess I'll throw that question out to both of you as kind of these 2 points on our understanding.
Sarah?
That's a great question. And I really, when looking at the other questions in tandem, because one thing that I didn't share. So wait, let me actually see if I have. Oh, well, I realized that we're out of time. So the least training topics that were least interested, I didn't share this: how to quit and reduce cannabis use, how to prevent cannabis overconsumption, cannabis use disorder recognition. Those were the ones that were the bottom. So I wonder if cannabis related health education is more of like this more of like the medical, like using for your health, like for your health. Um, and
Yes.
I'm curious if that's what you would,
Well, that's your next, see, that's you have your next job there and your next project. Yeah, I think that's where it is because it's like they want so much health education, and then they felt that the bottom of their responsibilities help people to reduce quit or to have, so, but they feel it's very important. Second most important, they have a positive experience. The customer has a positive experience. So I think somehow although the workforce has changed so much in so many areas, they have been 6 years in the job, so they are post legalization. They are not grandfathered in from the times of non-regulated cannabis to the industry. So it's new people, uh, but they still have the same sense. I don't want to educate on the areas of possible adverse effects, but I wanted to educate on have a good experience and a positive experience, which you can maybe make the case that helping them to avoid some bad experience can be a good way to go, right? But it will be interesting to tease out a little more what is health education for them.
yeah.
Very interesting. And there is also this aspect of respecting the individual. A lot of them, I wouldn't talk to a pregnant woman because they are not in a bar drinking. They are purchasing a private. I don't know if it's for their husband, for a party they're gonna have. How come I'm gonna start talking about pregnancy? This is not a place of consumption. So they had really good points, and they come and are gonna ask them if they're driving or not. That's none of my business. So, I mean, it's different from you're drinking a bar, you're clearly under the effect. So, there are important differences. And yes, we are out of time. It's already 4 minutes afterwards. But anyway, yeah, let's continue this conversation in a bar. I'm kidding.
Thank you so much. It was a pleasure to be here and present. And if you have any further questions or want to chat outside of here, my email is my first name dot my last name at lcb.wa.gov.
Thank you
You know
so
where to find
much.
me. Dia also knows
Yes,
where to find me. Thank you.
thanks so much. Thanks so much. Let's
Bye.
call the day. Bye-bye.